أشرقت نفسي بنور من فؤادي.
Assalamu alaikum, everybody. As Dr was saying, my name is Naseer. I'm a vascular surgeon based here at the MRI, and I specialize in lower limb surgery of both arteries and veins in both people with diabetes and non-diabetes. And I'm the director of the Manchester Amputation Reduction Strategy, the MARS project, which aims to unify the way ulcers are treated with a view to reducing amputations. And in our hospital, we've managed to reduce the major amputation rate by 23% over the last 3 years because of the sort of the added work that we do here, and the lessons that we've learned here, as well as incorporating lessons from across Greater Manchester and across the country. We're now changing services across the patch. My presentation today is going to be about lower limb vascular disease, particularly arterial disease, with the view to understanding how it presents, what the symptoms are, and how it can be treated. So I'm just going to share my screen to go onto the slide deck, and hopefully that you guys can see that. Yeah. Okay.
Yeah, it's fine.
So, brilliant. Yeah. So I've called it "Are Your Legs Killing You?" Because vascular disease in the lower limb is an early symptom of arterial disease in many parts of the body. So just as a oh, hang on, I don't seem to be forwarding the slides here. There we go. So atherosclerosis is essentially hardening of the arteries. It's like when you got your plumbing and the inside of your pipes become rusty. Essentially, exactly the same thing happens within your arteries as well. They become blocked, and the diagram on the, if I just show the laser pointer, these are your arteries here, and you can see this yellow bit here. This is the atherosclerosis that builds up on the inside of the arteries, and this process starts when you're young, and when you hit sort of 50, 60, 70, that's when it starts to become symptomatic. And essentially here is where the blood has an easy passage to flow, and then as you get older, this atherosclerosis causes a narrowing of the blood vessels. So the blood area, the area that the blood flows through, reduces, and then that causes symptoms. Now, the symptoms it causes depends upon where this atherosclerosis happens, and it happens in all parts of the body. But when it happens in the neck here, in the what we call the carotid artery, that increases your risk of getting strokes and mini strokes as well. When it happens in the heart, you develop either angina or a myocardial infarction or a heart attack. And exactly the same disease happens in the lower limb arteries as well. And it gives you exactly the same symptoms. So with angina, as you know, when you walk, you get this sort of tightening pain in your chest. And that's because the muscle, the heart is actually a muscle. There's not enough blood going to the heart muscle itself. And then when the muscle starts to strain, you get that typical crushing pain in your chest and in your heart. And exactly the same thing happens in the legs as well. But in the legs, we don't call it angina, we call it intermittent claudication. And what that means is you can walk for a certain distance and then your legs start to cramp up, mainly in the calves, and sometimes in the thighs as well, but the muscles cramp up. And then when you stop walking, the pain gets better. Then when you start walking again, the pain comes on, and that is a classic symptom of claudication. Now, when the symptoms get really bad, you start to get rest pain and then ulcers and gangrene, and that's when the blood supply is so poor that there's not enough blood even for the skin. So any form of minor trauma to the skin can then lead to ulcers, and because there's not enough blood going to the skin, all healing is delayed, and that's when I come in to improve the blood supply. So as I say, claudication is pain in the calves, and is classical pain of sort of tight cramping pain is exactly the same as angina, but it's in the legs. Now, this diagram here tells you what happens to the leg and to the person as well who has lower limb disease. So if you look at the population age 50 and over, and it's mainly a disease in people age 50 and over, up to about 1 in 5 people have peripheral arterial disease. And of those people that have it, over 5 years, the vast majority of people, about half to 75%, the pain either stays the same or it gets better. But in a minority of people, over 25% people, that pain gets worse. And when it gets worse, a small amount of those people end up needing an amputation. And this is the real tragedy, because a lot of this can be reversed early. But the key thing about peripheral arterial disease is that people generally don't die of problems with their legs. They die from a heart attack or a stroke. So this is why your legs can be killing you, because the symptoms of heart disease can often present much earlier in the legs. So you can often get problems in the legs, but the real danger is that it's a pointer for disease in other parts of the body as well. And a lot of the treatment for it aims to save your legs, but also save your life as well. So what are the risk factors for lower limb disease? Well, it's generally men get it more often than women. And as you get older, your risk of it increases. But the two main risk factors for it are smoking and diabetes. They significantly increase your risk of it. And obviously, high blood pressure also increases well. But the key message is smoking and diabetes increase your risk of this. So what are your treatment options? Well, there's loads of people that will sell you fancy diets, fancy machines, fancy exercise. But really, the reality is there's 3 lifestyle behaviors that we need to improve to reduce your risk of getting these conditions. And also, once you've got the conditions, to reduce your risk of getting complications as well. And the principle is 3-4-50. And the idea is that there's 3 lifestyle behaviors that contribute to 4 conditions that lead to over 50% of deaths. And it's all common sense, really. So 3 lifestyle behaviors are smoking, poor diet, and lack of exercise. They contribute to 4 conditions, which is cardiovascular disease, respiratory disease, type 2 diabetes, and cancer. And between them, these 4 conditions lead to over 50% of deaths. And it's actually about 61%, but 3-4-50 sounds a bit better. And people often get worried about exercise, right? Exercise, people often think you've got to go to a gym and you've got to be in a class and you've got to do something, complex and hard, but it's not. Simple walking is enough. And particularly for claudication, what you need to do is to walk until you start to get the pain, and then you slow down and you keep stopping and starting and go for as long as you can with that pain, because that pain actually stimulates the growth of new blood vessels. And you can have sort of supervised exercise programs, which are the ideal. But the reality is you need to keep on walking to be able to improve your risk factor profile for this condition.
So let me introduce you to Mr. Naseer Ahmed, who is consultant vascular surgeon and Manchester Foundation Trust. He is a vascular surgeon, and his special interest is diabetes and salvaging the limbs, so reducing the amputation. Naseer Ahmed.
That pain, because that pain actually stimulates the growth of new blood vessels. And you can have sort of supervised exercise programs, which are the ideal. But the reality is you need to keep on walking to be able to improve your risk factor profile for this condition. But when things get bad, things get really bad. And I'm going to show you some pictures now, and I'm just going to prepare you for some of the pictures you're going to see. So this is what happens when things get bad and you develop, from claudication, you can develop what we call a critical limb. And this is when the blood supply is so poor that there's not enough blood going to the skin itself. And here on the toe here, this is what we call gangrene, and this is what we call dry gangrene. But the foot here starts to become red, it becomes painful, and patients often have to hang their leg out of the bed at night. And those are the key symptoms of it. And this is when things get really bad. And this is when patients are often referred to me. And the things we can do, we can generally do 2 sorts of things. We can improve the blood supply by putting in a stent or a balloon, or we can do what we call an endarterectomy, where we remove the plaque, or we do a bypass. And the principle behind these stents and bypasses is simple. So you can see here the artery. This is where the plaque is. And by doing a balloon, what we do is that we basically just crush it. And by crushing it, you increase the size of the lumen, and so blood can flow through this. And the balloon goes in, it crushes the sides, and then we deflate the balloon and take it out. And sometimes we need to put a stent inside. And what that stent does is it continues what we call the radial force, which is the pressure on the outside to keep these arteries open. What I specialize here is doing the operations where we basically just cut it out, where we do a bit of cleaning of the artery, or when there's a long blockage, we often do a bypass where we take a bit of the vein. So the next couple of pictures, I'm just going to prepare you again. The next couple of pictures are around what an angioplasty involves. And essentially, so just to get your bearings, this is the patient's groin. The head is on this end and the leg is on this end. And this procedure is done under a local anesthetic. And so this is a local anesthetic going in. We then put a needle inside the artery. We then put a little wire inside. You can see the wire going inside. There's a wire going inside the artery. And then over that wire, we put a sheath. And once that sheath is in, that stays inside the artery for about, an hour or so while we do the procedure. Then we put some dye through that and we take some x-rays. And these are the sorts of pictures that you get. And you don't need to know the detail of this, obviously, but this black line here is the artery. And what you want to see is a nice black line like this. And in the bottom of the leg, there should be 3 of these lines going through. And in the foot, there should be a nice arch going around here. And what you can see here is, there's a bit of blockage here. There's a nice bit here. But this artery here kind of completely stops here. And this artery completely stops here as well. And this is what we often see. So where the arteries become blocked, there's reduced blood supply through the artery and to the foot, and then you start to get this complication. And then we need to do something to improve that. And we often put these balloons and wires inside these arteries to open them up. If that doesn't work, sometimes we do an operation. And this is what I specialize in doing a bypass. And this is the patient's left leg here. This is the foot on this side and the leg and the head is on the left-hand side here. And this is what we call the below-knee popliteal that's being exposed here. And this is the posterior tibial artery at the foot. And what I do is that once we expose them, we take a bit of vein out from the top of the leg and we join it from the top. And then this is the vein with the blood flowing through it. We then open up the bottom artery. I usually open up before. We've just got a little shunt going inside it. And then what we do is that we tunnel the vein underneath the skin and join it to that artery so that the blood flows into the foot. Now, these arteries are quite small. They're about 1 millimeter in diameter. And that's what I spend most of my time doing, just sewing onto these small vessels. So in conclusion, peripheral arterial disease is a common cause of pain on walking, but the important thing is that it's a marker for cardiac disease. Smoking and diabetes are significant risk factors for it, but a simple approach can help reduce the risk of this disease, and also once you've got the disease, to help in stopping the disease getting worse as well. Thank you very much.
أشرقت نفسي بنور من